I'm Jason Posner from Boca Raton, Florida. I'm here with my good friends Greg Mueller from Beverly Hills, California, and Barry DiBernardo from Montclair, New Jersey.
Yeah.
All plastic surgeons and all have integrated this device into our practice. So we're talking about Sofwaves and the patient experience. So let's talk a little bit about what this is. Barry, you want to explain this?
Sure. It's ultrasound. It's an ultrasound treatment that treats just under the skin in the right layer.
And what about different skin types, darker or lighter skin types?
Doesn't matter at all.
Ethnicity?
Ultrasound does not care what color the skin. It does not work on melanocytes.
Well, suppose I went to the beach yesterday to have a tan. Can I do it?
You can still do it because it doesn't work in that way.
That's pretty good. I knew that.
So this one just goes right to the skin. This is not going to melt fat or anything else like that.
Correct.
Right, because this transducer in this version now is focused at between 1.5 and 1.8 millimeters under the skin.
Just the skin
Just the
itself.
skin. Your skin on your face is maybe 3 to 4 millimeters thick if you're really fat, maybe 2 millimeters if you're really thin. So this is well into the skin, not in the fat, not in the nerves. And let's talk about age bracket a little bit with this. To me, looking at having had this device for 8 or 9 months now, you can treat younger patients, the millennials who are looking for sort of that pre-rejuvenation. They want to kind of prevent aging. We can treat older patients who may not be, who you look at and you go, you need a facelift, but they're not surgical candidates. Maybe they're on blood thinners, doesn't break the skin, blood thinners are fine. Or maybe had some medical problems precluding any invasive surgery. I don't think you're going to get a wham result in an older patient like that, but it's still going to give them some result when their options are pretty much zero.
What's the ideal patient
I
range?
think ideally for me is 30s and 40s, early 50s with good skin, pre-facelift crowd.
If you've done a facelift and the patients ask how long is it going to last, well, a year later, skin starts loosening, and they don't need to do another surgery, but they can get some spot treatments with this. So it is a good adjunct for post-surgical patients as well.
Then how many facelift patients that you look at, you look great, and they're like, well, if I go like this, I got a little bit of laxity here.
Right.
Sure, we'll zap you a couple of pulses, and I think they'll be happy from that. So that little touch-up thing is amazing because that's a point, and also this is a point of care sale, meaning the patient comes into your practice, you want this, you have time on your schedule, you can do it now. I don't need to schedule this 3 weeks from Wednesday.
This has built-in cooling. We talked about heat, but this has built-in cooling, so that cooling balances what we're doing with the treatment.
So would you just put numbing cream on, or how do you prepare the
just
patients?
a little bit of numbing.
Okay.
You can do it without numbing. It
Sure.
has the built-in
I did it
cooling,
without
and you
numbing.
can regulate that. I had it done with a light layer, and I almost fell asleep.
But really, this thing doesn't hurt,
really
especially at the
don't need
lowest
that.
settings. It's very effective, and I think we can kind of look at some of the results that you can get from this. Is that all right?
We talked
Sure.
about the safety and all that, but really the proof is in looking at photos, so let's do that. So we have a photo over here. What you're seeing is this is an older patient, some jowling, some sagging, some wrinkles in the skin there, and then afterwards, like focus in on things. Focus on these direct wrinkles. Those are pretty much gone. And look at this contour in here. You've got, it's not surgery, but it's a very nice result.
And this area just kind of shrunk up. That's how I see it.
Absolutely.
And that's a hard area because there's fat under here and it's sort of the most dependent portion here. The muscles are tight here, so this is a loose area.
This is my patient actually, and she brings a lot of qualities into this. She's 63 years old. She has looseness around, but I think the plastic surgeon, she doesn't need a facelift.
No.
And the other thing is a little darker skin.
You worry about poor healing scars and darker
So
skin people.
we took this with a 3D camera, and look, this is a month after a single treatment. Look at how it just
well, look at the
tidied all
jowl. Look
that
how the
up.
jowl improved. That's
We
that's
had
what I see.
squareness here, and now we have a nice smooth contour. So when
Is she happy?
Oh, she's thrilled,
Wow, that's
and when the
amazing result.
patients see that kind of result, and they didn't have to recover from it, it's a reasonable cost for them. That's a game changer.
This is amazing. I mean, even the corners of her mouth, you sort of elevated those a little bit. She was down, turned here. You can see the effects.
Even look at even the infraorbital area as well. I think that speaks for itself. The Sofwave device, non-invasive, and as we saw, great results.
Any skin types, no bruising, no redness, beautiful. So if someone's interested in getting this procedure, they can go to softwave.com